Good morning. Today I'm going to demonstrate how to take care of bleeding and shock. The first thing we need to do is to make sure that the person is either responsive or not. And if the person is bleeding, you put your gloves on and find the bleeding spot. Then you use a clean cloth or heavy or a gauze and or anything you can have that is clean to cover the bleeding and put pressure on it. If the bleeding doesn't stop after a few minutes, then you need to add more gauze or another piece of cloth and press firmly on the spot, on the wound. After that, you can put some of this elastic band over it and not too tight, but just put it on the wound so that that can help you to take care of other victims if there are other people that you need to help. Another thing that you can do after 10 minutes, if the bleeding does not stop, you can also use a tourniquet. So you put it around the wound, wrap it, and tie it up. Once you do this, push this little stick through the hole and turn it. Once you turn it tight enough, you lock it in place. That will help to stop the bleeding while you wait for the EMS to arrive if that's needed. Another thing that you do, if you find a person that is in shock, what you need to do is to first check if there are no injuries to the legs or the spine, because if that's the case, then you need to leave the person flat on the surface. If not, if the injury is on the head, you need to elevate the person, put it in the sit-up position, and have a rest there. You never know if there's an internal injury, so you need to leave the person alone, and that's the position you need to keep them. Another thing that you can do when the person is in shock, you can also elevate the legs in case there's no pain on the legs or the back. You can just keep them flat with the legs elevated. And the last thing is that when the person is unresponsive and in shock, you're going to turn them on their recovery position on the side with your head on the left hand under the head and this way. Keep them like that. Just in case the person starts vomiting, he or she won't vomit on and choke with it. Okay. And lastly, when you finish cleaning up wounds and everything, then you need to take off your gloves and dispose properly of them. And that's it. Thank you.